So today's speaker is Jeanne Marie Hagan. She is a social worker, organizer, foundation programs officer, Peace Corps volunteer, and a consultant to nonprofit organizations. Jeanne Marie is the Director of Program Compliance at Women Against Abuse and has agreed to join us today. Jeanne Marie provides oversight of all compliance monitoring of contracts and grants and is responsible for the overall administration of the agency's performance management database and the establishment of achievable and meaningful program outcomes. Jeanne Marie, we are so grateful that you were able to join us today, and we're looking forward to hearing from you regarding the programs that you run at Women Against Abuse and the way that you use technology to drive additional performance.
Thank you. I'm happy to join you. I'm pleased to tell you about Women Against Abuse and why we love ClientTrack. So Women Against Abuse started off as a grassroots organization, as many domestic violence organizations have started across the country in the mid-'70s. We started off as a grassroots organization providing a small hotline in Philadelphia and a very small shelter out of a Victorian home in West Philadelphia. And today we've grown it really into a much larger multi-purpose social service agency that provides a continuum of services to those experiencing intimate partner violence and domestic violence. As you can see, that we serve over, through our services, we reach over 15,000 people a year. That is through a really robust community education and prevention programs that we have, and those for victims, we're able to provide that continuum of care. So we have 2 emergency shelters in Philadelphia, the only 2, sadly, in Philadelphia. We are able to provide transitional housing units, 15 units to women and their children in both of our 2 emergency shelters plus our transitional housing. Those are all confidential locations in Philadelphia. At those housing sites, we're able to provide multiple supportive services to those women and children through case management, children's services. We have a behavioral health team that provides individual crisis and group counseling sessions. Our children's services team provides on-site daycare, on-site after-school and tutoring help, plus a summer camp. We're also unique as a domestic violence provider that we also have a very robust legal services team. We actually have on-site attorneys, court advocates, a police liaison that works very closely with the department. We're able to provide, again, that continuum of care for victims. We are able to serve both men and women in most of our programming, except our on-site emergency housing. We also operate with 3 other partners the Philadelphia Domestic Violence Hotline, which provides safety counseling, supportive counseling, and is the entry to our emergency shelters. I would say that in addition to all those social service opportunities that we give for victims, we also have a really important function, which is advocacy. We employ a lobbyist on a local, state, and federal level for domestic violence issues, and then we're also advocating. We have a public policy coordinator, which is luxury for nonprofits, but we find it vitally important, and so we are able to provide resources to supporting public policy work and lobbying. Yep. So back in 2012, Women Against Abuse went through a reorganization internally in order to strengthen our infrastructure. As we were growing exponentially, we knew that we were going to get a second shelter. We were expanding our legal services. We were creating more community-based partnerships with other organizations. And we knew that as we were growing, we were getting a lot of new government contracts. And with any new government contracts, everyone knows that there is a list of maybe 40 or 50 special conditions attached to each contract that we had to make sure that we were in compliance with, and the numerous funder reports that, of course, never correspond to each other or never are asking the same unique, nuanced information. And at the time, Women Against Abuse had, basically each department was in charge of their own reports. And we knew that as we were growing, we needed to make it synthesized and really needed to kind of have one department that was in charge of that. And so the Program Compliance Department was created, and it now has grown to a staff of 4. And that department, we review all grants for compliance, we submit all external funder reports, and we coordinate our client database. This has proved to be vitally important to have one department or at least a group of staff that are dedicated to this type of work instead of having it split across the organization. So I was hired to test out the current database, which staff at that time were not happy with. And so we tested out several different products, and ClientTrack was one of them. And what we were looking for is we needed a new solution. Because we had a legal center, we had really special confidential and security measures that needed to be addressed to make sure that that data was protected from the rest of the organization. We also wanted to integrate a few departments that had been operating either with separate databases or were just flat out just using Excel to manage processes. We also knew that since we were probably getting the second shelter opening up, we were going to have at any given night 200 beds plus transitional housing units. So to really have a robust housing feature was really important to us. So we really needed to upgrade our technology across the board. We also received a lot of different I received a lot of feedback as I met with every department going into this process to get buy-in and to get feedback, is that the end users, our case managers, our court advocates, our line staff, really found our other systems really cumbersome and not intuitive. And so when we tested out ClientTrack, just I think from the first day when we were just showing the demo and kind of even just visually saw the interface, I think it was just so intuitive that, like, oh, I knew that our staff was going to, no matter of their computer skill level, could figure out, you know, which buttons are important to me. So we really needed those kind of intuitive workflows. We needed the end user experience to be really kind of easy to use. For mobility, we definitely needed 24/7 access and support. We have an intake unit that, as I said, we manage the domestic violence hotline for Philadelphia, which is 24 hours. Our shelters operate 24 hours, so we needed something that also could be used mobilely, perhaps in court, that we might have a court advocate or a lawyer, attorney that is in court and quickly needs to use ClientTrack to see a client history or to check a conflict. We use ClientTrack for attorneys and legal services can check to see if a person sitting in front of them is actually a legal conflict for them. And so we needed that. We now have several staff also that are stationed as domestic violence advocates in other systems. So our Office of Supportive Housing, we have a DV advocate there who actually can do an intake from that office right into our shelter. So they needed to have ClientTrack either on their laptop or on their iPad, something like that. We also now have a DV advocate stationed at probation. So we also wanted to have, and they don't always have a dedicated desk, so we needed to have them to be mobile as well. Also, you know, that bullet right there, increased efficiency in reporting is so important in my department. The amount of staff time that was dedicated to manipulating our old database or individual program departments using Excel to keep client data in was just really slowing down our reporting process. And now, a year later after implementation, we are much more efficient than we were. And again, eliminating any manual processes of hand counting, clipboards, checklists, intake check sheets, housing check-in, having it all kind of combined into one system was really important to us. Yeah. So as I mentioned, these are some of the features of why we chose ClientTrack. Number one was the security functions. We needed to make sure that we had special organizations set up, especially for our behavioral health and legal center teams. Because of attorney-client privilege, we couldn't have most of our staff actually access legal center data, and so the organization features in ClientTrack was able to do that really easily. Same thing with our behavioral health team. They wanted to protect case notes, so that was pretty easy to set up. Housing management, our intake department is just, a real small staff. We operate 3 housing sites, but we only have 1 intake department, and they're physically located in one of our shelters. And so they were, I will tell you that they were tracking all of their housing check-ins via a really large dry erase board. And it was manageable at the time. They just had 1 shelter, and they were able to kind of manage that. But opening up a second shelter, having staff not at that site, that was no longer possible. And the first time that my staff saw a demo of ClientTrack with the housing tab, and we were able to replicate that whiteboard almost perfectly, was really great. That visual, since folks were really visual in our intake department, they wanted to see the room, they wanted to see the client, move the clients around via room. That was a real selling point for us. Since that has happened, we've also incorporated rent collection into our system, and that is with our transitional housing. We actually collect savings payments for them and hold that for clients, and we're able to start tracking contributions that they're paying to us. We've also had thought about when we were moving towards ClientTrack to, as I said, integrate a few departments that had separate processes. And one of them was the facilities management team. They had a work order system, which was basically, if a client room needed to be cleaned, or if there's like an air conditioning broken or something like that, we were on a paper system. And we had talked to ClientTrack about doing a custom, kind of integrate that into our original scope, which was done. And now we're thinking kind of even more moving forward and thinking about doing preventative maintenance system and tracking assets, as in like furniture and vehicles, things like that. So that's something that we definitely didn't want our facilities department to have a separate facilities management database, because we didn't want to have multiple systems that wouldn't talk to each other. So we were able to incorporate that into ClientTrack. Something that we've just started trying out is incident reports. That, again, is something that was a separate process, mostly paper-based in our shelters, and that was something that we just started using with ClientTrack. That last bullet point, lobbying system advocacy, as I said, we have a really rich lobbying and advocacy efforts through our public policy department, and need to track that for a variety of systems, either different funders, or we need to report that to the IRS, things like that. And so we were just using Excel. And so again, trying to limit the amount of separate processes, ClientTrack was able to build a pretty simple tracking portion that is not related to clients, but that's something that we're able to, kind of prevent relying on Excel to track things.
Jeanne Marie, there was a question that came up that was asking, how did you go about creating the facilities management system, and specifically the work orders?
Basically, when we talked to ClientTrack initially about our scope, this was one of the ideas that we had actually identified before we chose ClientTrack. So when we went to each vendor and then we want, these 4 things, facilities was always part of that list. And so basically we sent ClientTrack our simple work order form and a spreadsheet that we had that was tracking, it was a huge spreadsheet that we were tracking how many beds were at a facility and when they were purchased, and the ID number and the warranty and things like that. And they basically came back to us and made a suggestion of how they were going to build that into the system, and we just kind of went from there. So it wasn't like something that we had specifically in mind beyond, this is what our current work order paperwork looks like, and this is what our current tracking form looks like. sent it to ClientTrack, and they came back to us with suggestions. And so it's actually not associated with the Client tab. When you look at ClientTrack, it's actually, I think, an additional tool. But our housekeeping team and maintenance team are all part of ClientTrack. So as a result of, I think, WA, Women Against Abuse, has always, especially in the last 5 years, have really been looking at data, looking at trends, always analyzing. I think for a long time, as a lot of nonprofits are, we were very reactive to just funder reports, making sure that whatever requirements we had associated with the funder report, we were, fulfilling those requirements. In the last 5 years, we've had a shift. Since our infrastructure has changed, we've dedicated resources to upgrading our technology. We've dedicated resources to create a compliance department that looks at things like this. And now we're looking at every department and kind of creating their own metrics internally. And because we're always looking at data and what our trends tell us, we were able to use hard data in advocating for a second shelter in Philadelphia. So we're really proud that this past June we were able to open up the only second shelter, so we now have 200 beds any given night for women and children in Philadelphia. So as I said, we use data to determine that. I mean, I will not minimize the amount of advocacy of WA and our partners did around this, but what was really helpful is that we were able to track for a few years the increase on our hotline of calls requesting shelter, and we were able to track something that we were calling a turnaway. So every time someone called, we would record the number of adult and children that requested shelter on that night, and then that we had to turn them away because there was actually no space dedicated for a domestic violence bed that evening. So we were able to do this in the past, and once we built this into ClientTrack as well. So over the past year, it's been really easy to track turnaways for not only folks on the hotline, but also our one case manager who is co-located at the Office of Supportive Housing, that she's also tracking any turnaway. If she does an intake and there's no dedicated domestic violence bed that night, we're able to continually track that. So we're always, every time we do advocacy, every time there's a report that goes out, every time that we're talking to a legislator, we always internally look at what's the hard data telling us and where are the trends going. So it's not just trying to make the case of that domestic violence, it's something that you should support because it's a good idea. This is what we're seeing on the ground. This is the hard data, and this is what we think. If you build a second shelter, this is what we think will happen. So I think one of the biggest benefits beyond having a happy staff that are case managers that are happy, that have a much easier interface, that I think our data collection actually has improved drastically because the amount of the ease of which staff can check their own work. But I think managers who previously were not really using our former data database, that they're able to kind of quickly track and analyze client demographics data on a monthly basis. We're able to kind of maintain more history. We're definitely collecting much more data in ClientTrack than we were in our previous systems. And it's also, we're also, I think, as a performance-driven organization, we're really tracking trends. And I wanted to highlight 3 things. One is that we know that I don't know how it is in the rest of the country, but in Philadelphia, human trafficking and IPV, we know intimate partner violence, we know that there is a direct link and overlap and correlation, and we're seeing it in our clients. But there's not a lot of research out there that is kind of tying that together. And so what we've just done for this fiscal year is we asked ClientTrack to upgrade a few of the assessments that we're already using to track when staff are identifying through client stories and assessments that we think that they're a victim of human trafficking. And we're going to see where that data takes us across the organization. We already track it on the hotline. We want to see who's coming into our shelters. We also want to see if there's anything going on in the legal department around human trafficking and what that intersection is. And then we think that we can start telling the story and then talking to affect public policy in Philadelphia and the state of Pennsylvania around that. The second one is high lethality assessment and indicators. As domestic violence advocates, we know that there are certain high lethality indicators for women and men who are trying to leave an intimate partner violence situation, strangulation, does the abuser have a gun, such things like that. Those are things that we are tracking via our hotline and our case upon intake of our shelter. And so we are now starting to try to analyze and see what those indicators are telling us. Does that mean someone is coming to us multiple times? Are they entering the legal system? Should our police liaison get involved? Things like that. The third item is where we're moving forward and tracking trends and things like that is a telephone outreach program. Philadelphia, we have a really unique partnership with the Philadelphia Police Department where they send us every police report that involves domestic violence in some way, and our staff read every one each month. And then we look at that for some high lethality factors, and then we actually call the victim on the police report and offer them services. So now we've been doing that for a few years as a pilot program. It's now an integrated program, and now we want to see what does a few years of data tell us. What's happening once we reach out to them? Do they come into our system? Do they get the help they need? Are they in a cycle? Things like that. So this has given us the ability to kind of step back, stop being so responsive, still responding on time to funders, but also just kind of deepen our understanding of what's happening here. Next. So as I said, the amount of time that has been saved via the reporting functions in ClientTrack has been a real advantage to my department as well as the whole organization. We were really a paper-based organization, loved those Excel spreadsheets. Each department had their own, had client data in our old database, sometimes not in the database, and we were really able to free up staff time for case managers and attorneys and such like that, just to quickly go in the system, put in the information they need, and then my department either pulling it out or managers or even staff checking their work has been a great advantage. Just some of the lessons learned. I think one thing is that one thing that we found that has been so beneficial is having dedicated staff. We know every organization can't have the luxury of a program evaluation department or a program compliance department, but having dedicated staff that are in charge of setting data protocols or overviewing all funder reports or data quality has been really vital to our organization. It's really shifted the culture here. Folks are on every level now, like really, I think, buying in and owning their own data, which hadn't been happening in the past. One thing that we learned, or we wish we had double the amount of time that we had for planning. We were trying to move pretty quickly, getting into a new system. We had a clear plan and vision, but as everything in life, we could have used double the amount of time for planning and buy-in and getting feedback from staff. We allowed every current database user at the time to have input. So we had a meeting with every department. Folks were able to give us feedback. I still made some high-level decisions about what went into ClientTrack and what didn't, but I think it also helped with buy-in when staff made some, suggestions that we totally agreed with, and they got to see it in the final product. I think one thing that we started as we were going is that our organization didn't have we have a clear, very training kind of protocol for a lot of like our social workers and case managers that we have to fulfill, but we never really talked about internal training for our database. And so since then, we've created a few things that's been really helpful. One is our department always trains new users in ClientTrack. We offer quarterly refreshers for all users. We just went through one maybe twice a year. And then we created something called an All-Stars program, which is basically our ambassadors. We identified several key staff that either were enthusiastic about data, were just high-level computer had high-level computer skills, or were just asking questions like, hey, I noticed this reporting feature. Can I go in myself and start running reports? And so we kind of get together quarterly just to kind of review ClientTrack, get feedback, show new features, and then just kind of talk about how we can support each other. Another key element is incorporating data responsibilities across the board. Our department has incorporated data responsibilities in job descriptions, everyone from our maintenance staff on up, making sure that part of our orientation program there is a ClientTrack training. And then through supervision, everyone in this organization has a supervisor, and we do have to have regular supervision. And we talk about data, talk about reports, how folks are doing, and that has been really helpful. And the last bullet I would just say before Carol starts is managing expectations, is having a really good communication with, we have a really good account advocate, client advocate at ClientTrack, and we're always in contact with her, and sometimes she can help to manage our expectations on our end and vice versa. So that's really helpful.
Well, thank you so much, Jeanne Marie. We're going to go ahead and continue with the demo portion, but I have a couple of questions that have come in while you were speaking, so I wanted to address those right now. We have a question that came in. How many staff members does your organization have, and where do you obtain funding for your compliance department?
I think the latest is we have about 140 staff. I believe. It's about there. I don't think it's above 150 at this point. We just, as we added the second shelter, we added something like 40 new staff members. So we've grown pretty quickly over the last few months. Our compliance team, we don't have any dedicated funding, but every time that we charge a funder that admin fee, that's where most of our funding is spread out. So we rely on general operating grants through foundations, and anywhere that we can charge that nice little 15 to 20% admin fee on contracts, that's where we spread it out mostly over our accounting and compliance departments.
Thank you again. And then one more thing before we move on. You had mentioned about the 30% increase in reporting of cases. Can you just really quickly speak to that so that the audience knows more about that?
Via our hotline, or?
When we were speaking the other day, Jeanne Marie, you mentioned statistics with kind of the new awareness that's taken place with domestic violence.
Yeah, we were actually able to, we were curious. We heard anecdotally from our hotline that calls had increased in September after the Ray Rice NFL video was released and all of the back and forth by the NFL. And so we were able to take a quick look, and we compared September of last year to September of this year, and we did, Philadelphia saw a 30% increase in hotline calls, which we took to meaning increase in awareness. So we saw an increase of not only victims calling. On our hotline, we're able to kind of track victims, self-identified victims, third parties like professionals, like social workers calling from another organization, or we found a lot of friends and family calling the hotline and wanting to saying, you know, my sister is being abused, what information is out there. So we do not think that there was an increase in abuse. What we think was that we've seen an impact of awareness. So it was easy, it was actually very easy for us to kind of quickly go in, run a quick report last September versus this September.
Okay, one more question has come in. Can you please describe the interactive use of ClientTrack by your case managers and others working with individuals and families, and how that has improved outcomes such as length of stay, attaining permanent housing, etc.?
Well, the interaction between case managers and other staff via ClientTrack, I think we've improved the number of internal referrals that have gone between case management and behavioral health. And I think because so many staff have access and can review client data where it's appropriate, let me just say that. I think that it's easier for them to identify when we see a barrier of someone coming in with a drug and alcohol issue identified, identifying that this is possibly maybe a referral to behavioral health needs to be made. Internal referrals are being made via ClientTrack to the legal center and vice versa, where that had been kind of previously maybe a phone call or an email, and we're thinking that that's improving kind of efficiency and folks are not falling between the cracks with phone calls and emails and such like that. I think the data, I think tracking has been really, has absolutely drastically improved. The amount of tracking that case managers are doing with their time, I have to be honest that I think that we were underreporting sometimes our client hours because of the kind of clunkiness of our old system. We would pull reports out, but it wasn't really easy for line staff to check their work, and now they're able to, at any moment, do some quick service summary reports and say, that doesn't seem right. Normally I'm about 200 hours a month. I'm only at 100. Let me look at my client list. Oop, yep, I missed a whole day of putting in my time. Groups were never really being tracked in our database previously, and with ClientTrack it's pretty easy, so we're able to just monitor. So yeah, and I think once we see clients, we've used, what's nice about ClientTrack is that we're using all HUD language and categories, so able to kind of see where clients are coming in and moving to, all with the kind of HUD perspective, has been improving incomes because we're tracking those, permanent housing placements. I'm not sure if that's exactly what you're asking, but.
Perfect. Thank you so much. I'm going to now turn the time over to Carol Anderson. She is a solutions engineer here at ClientTrack. And Carol has been working with organizations such as Women Against Abuse for many years. Excuse me. Sorry. That's okay. So she has over 18 years as a technical training specialist and worked directly with Women Against Abuse to train them after the implementation of ClientTrack. So she's very familiar with this client and with the needs of their organization. Carol, we'd love to see some of the information that you shared, some of the reports, workflows, et cetera, as it pertains to Women Against Abuse, and then just anything that ClientTrack can do that some of our users or some of our listeners may want to ask questions about.
Perfect. Yep, I'm really excited, and it's been great to listen to Jeanne Marie. I know that they have done some amazing things at Women Against Abuse, and I knew that when I went there and started training that Jeanne Marie and her team, they're very, very sharp individuals, and they obviously have they're very passionate about addressing domestic violence in a way that makes sense. And glad to hear your successes, Jeanne Marie, so thank you so much for sharing those with us. I'm going to take just a brief moment to share with you a little bit of the functionality that Jeanne Marie spoke of. I know there were some other questions that were here, and I want to make sure and leave time for that. But for those of you who have never seen ClientTrack, just kind of introduce you a little bit to the interface. ClientTrack is a web-based system, and as Jeanne Marie said, it gives you the ability to be mobile and to access it from mobile devices. You are going to be able to access it from an iPad, an Android device, a smartphone, etc. And all that you have to do is open up a web browser on that device, and then it will open, then you go to a URL for ClientTrack, and then you can get the full functionality of ClientTrack, everything that is part of that on your mobile device. ClientTrack is set up in such a way that it's easy to navigate. One of the things Jeanne Marie said is it needed to be easy for people to use. And so we try to be very consistent, very logical about that in the way that we present. There are tabs across the top. On the Clients tab, you're going to have information about the client and how we work with individual clients. There are some information that is shared, and being in the domestic violence space, we're very considerate of how information is accessed. And so one of the things that we built into our domestic violence baseline solution was a way of tracking the access, and so we could see who was looking at an individual client record and when. So there was a tracking mechanism to find out kind of what's going on, who's looking at this, and should they be, right? So that kind of information is there. Also, the way that we share case notes and everything, ClientTrack has a very robust security system or security model that will allow you to share individual pieces of information on a form or individual, so case notes. Somebody can go in and the legal advocacy group can set up their case notes, so their legal case note is a read-only for those people there, and they cannot be modified. And then they can't even be viewed because of that attorney-client relationship. They can't be viewed outside of that legal advocacy organization. So when it comes to this particular functionality, we're very set up very well to handle that kind of special security kinds of considerations. On the Clients tab, you'll see that there are several different options over on the left, and you simply select the one that is appropriate. As Jeanne Marie said, that they have a hotline call workflow. This is going to guide their hotline call staff through step by step, and you can see that they're step by step up here in the upper left, the different pieces of information that we need to gather on those types of hotline intakes. When you start this, it's going to record the start time of that particular call, and then you can identify if it's a call, a walk-in. We can even identify which line they called in, so if we want to track and see which area, which number, or how people are getting to us, you can identify the phone line that they call in. Maybe somebody wants some information. We can select what type of a call it is, if it's a crime or victimization call. You'll notice that different options appear based on the type of call that is, because if it is a crime or victimization call, the first thing we want to know is if 911 is needed or not. And also if they want to identify themselves. If it's an identified caller, it will allow us the opportunity to look them up inside of ClientTrack using some searching functionality. If it's an anonymous caller, we can leave it that way, and then we can also identify the language that is spoken for that particular contact, and then whether or not the caller is a client, if they want to remain anonymous, how they want to proceed. And then we click Save. Now what will happen is that this call flow here changes depending on how we answer this. So it's very logic-driven, and your folks aren't going to have to wade through and say, oh, well, we don't need this because it was an anonymous call. We don't need to get this information, or we need this information because somebody is requesting help and assistance. So then it takes us through, and it actually sets up an anonymous client where we can identify some information for them, maybe gather a birth date if we want to. And you can set up certain fields so they are required. So if there's certain things that are required, and this comes in particularly handy when you're dealing with a lot of regulatory grants requirements and stuff like that, you can make sure that the things that are required are gathered inside of your database, so you have that information. You can also identify the gender or who may be calling, and then any other information that they may be willing to share. And you just simply click Finish when you are done, and it's going to walk you through step by step, and you'll see at the bottom we have kind of an example of our security and how you can restrict it to only people that are in this organization. You can share it with all the organizations that are in ClientTrack, or you can have an information release, a memorandum of understanding. So that's an example of that. I won't walk you through the entire workflow, but I just want you to know that this is the thing that makes sure that people are treated the same, right? So they all have that consistent experience when they call Women Against Abuse or whichever domestic violence agency we're working with. And then the staff members don't have to, they've got enough to focus on in making sure that the person who's calling is safe or has the things that they need. So they don't have to focus on what kind of information do I need from them. It'll just walk them through that very carefully, very easily. So that was one thing that Jeanne Marie mentioned, was kind of those hotline calls and being able to track the turnaways so we could find out kind of what that big need is there, and so we can really present that and say to our funders, we need the ability to open this other 100-bed facility because we're turning away so many people. And I know when I spoke with Jeanne Marie, we kind of talked about just women, but there was such a big need for men to have that same kind of access to services and housing, that there was a big gap there, and they were able to identify that way. One of the things that Jeanne Marie also mentioned was a housing tab and housing management, and that's one thing that at ClientTrack we have a great way of housing, identifying different facilities, and being able to view the different facilities and to see how many beds were available. For the emergency shelter here, for example, I could see how many beds are available, and so anybody at any of the locations could log into ClientTrack and quickly see, is there space at that facility? And if there is space at the facility, we could make a reservation for them or put them on the waiting list if they didn't have space. And it was just simply a matter of checking a box or checking on one of the hyperlinks, and then that would allow you to view who's on the waiting list and add a new person to that waiting list. So those are some of the things that ClientTrack does well. Also, the reports, those pesky reports that were all in Excel databases and took many, many hours to create. One of the things that is amazing about ClientTrack is that we are dedicated to compliance. That's one of our 4 pillars. And so you don't have to worry about the changes that come up in compliance types of reporting. So your VOCA reports or your VAWA reports or your HUD reports. There are different HMIS reports that Jeanne Marie was mentioning were particularly helpful to them for the APR reports and the CAPER, right? So you can see the CAPER report, and you can click on that report and you can set this up. And one of the nice things that I've known as I've worked with different organizations is that they really appreciate the ability to schedule this report and have it run on a periodic basis so they could review it more often than that once a year when that report was due. So ClientTrack has the ability to schedule those reports. You just specify what your criteria is, and maybe we want to do it for the previous month. And when you select that, and you can filter it by different grants or different programs and select multiple grants or programs, and then you can schedule that report to run on a regular basis. This empowers your the different program managers to stay really on top of their individual programs, because they know how many people are enrolled in their programs. They know the people that are in the shelters, and it gives them the ability to compare what's in ClientTrack with what's actually happening. If you'd like to receive a further demo of ClientTrack, certainly contact us and we'll be able to take you through a full demo, taking into consideration the needs of your particular organization.
Thank you so much, Carol. We had a few questions come in, but I believe that you answered them as you were speaking, so people were following right along with you, so that was fantastic. If anyone has any additional questions, we will keep the line open for about 10 more minutes to see if we have any additional questions that come in that we can answer. Go ahead. Jeanne Marie, we did have someone contact us to ask if they could contact you following our presentation today. They said that their agency is very similar to yours and they would like to ask you a few specific questions. Would you be open to that?
Of course. I'd be happy to.
Okay. I thought you might say that, but I wanted to ask.
Yeah.
And I will, so to that person who asked that question, I'll be happy to share her contact information following today's event. So we do have one question that came in. Are there different access levels so volunteers can enter hotline calls but not access client records? Also, how much does ClientTrack cost?
That's a really great question, and the answer to the first one is absolutely. We have a concept called work groups that will that can determine what is visible to the different groups. So if you're in an intake work group, a volunteer kind of thing that does just the hotline calls, the only things that you would see inside of ClientTrack would be that functionality that is for hotline calls. You wouldn't have the ability necessarily to find a client or to add a new client if that wasn't part of that particular workflow. So we absolutely have that way, and that's one of the things that makes ClientTrack very user-friendly, is that ability to really make it only visible the things that you need and not overwhelm you with all of the rest. And then the people that need to be able to do the case notes and the goal planning and all that kind of stuff would have the ability to do that. They would be in a different work group. The question about how much ClientTrack costs, I certainly will direct you to contact us and talk with one of our solution consultants, and they'll be able to listen to the needs of your organizations, because there are many different considerations when we're looking at pricing for that. If you have a lot of volunteers, we may use a concurrent licensing model versus a named user license. And so there are different things that they can explain to you, and we'll be able to provide you with a cost for that solution.
We have another question. It asks, is ClientTrack housed in the cloud or on a server?
Well, it's kind of on a cloud or on a server. You actually have the choice. ClientTrack is one of those organizations that we give you the choice. So you can either do it in the cloud on our servers, and our servers we host with an organization called ViaWest, and we recently upgraded to the new HIPAA. We've always been HIPAA compliant, but now we're kind of even HIPAA on steroids, I guess, if you could say, because of the sensitivity of client information. And I would say probably 95, 96% of our clients are in the cloud. And that's the way they choose to do it, because then they don't have to have technical staff maintaining servers and worrying about the network and the security that way and the uptime. But we also do give the option for those organizations that do have the technical staff and they do have the servers themselves, that they can do a self-hosting option.
Great. This particular question, I'm using another software. Can all the data be transferred to ClientTrack when we migrate?
Absolutely. That's one of the things that we work with you on, is determining what type of data you want to bring over from your other solution. If you want to bring demographic data, if you want to bring transactional data over with that, and based on how many data points you want to bring over, then we can tell you kind of what the cost is associated with that and discuss kind of the feasibility of that. And we'll use our experience over many years and many organizations and give you some advice on maybe how to best bring that information over.
Okay, the next question is, are there any areas in the program to track employee training, volunteer info or hours, or just an area to track more staff volunteers-based information for the organization?
Absolutely. We have a volunteer tab where you can record the volunteers, anybody that volunteers with your organization. We can record information for those volunteers. We can track their volunteer hours as well. And we even have the ability to go in and track. I was working with a group yesterday who wanted to be able to track volunteer hours that were done by their clients. Because they are part of their requirements is to give back. So ClientTrack has what we call a baseline solution that gives you a big portion of the functionality that you might use in your organization. But we have some amazing design tools that also give you the flexibility to create any kind of solution you want. If you'll remember, Jeanne Marie was saying we had them add this more robust assessment for the lethality because we have that flexibility, and ClientTrack is really designed to be with you for the long term. So as your organization grows and your needs change and you evolve, that ClientTrack can evolve with you.
Perfect. Jeanne Marie, this next one is for you. It asks about the challenges or potential challenges with funders making the shift monitoring electronic files. Did you have any challenges with the funders making that shift?
I don't know if can you repeat that question one more time? It's challenges with funders accepting electronic files? I didn't understand that, sorry.
Well, it says exactly, have you had any challenges with funders making the shift monitoring electronic files?
Oh, gotcha. Well, we actually have not fully made the shift to 100% electronic files. So if we are ever, we do put all client information into ClientTrack. We are actually moving forward and looking at like our intake paperwork where clients sign off on things, doing electronic signatures within the system, so all staff know that certain, intake items were completed. But as far as like we still do, I will say that we still have paper files because of that issue. Because of domestic violence, protection under VAWA, and others. In Pennsylvania, we have further protections so that no third party can actually see and monitor any unredacted files. We always would have to have some sort of paper file because we'd have to redact it. We only have a few monitors that actually come out and look at paper files because of those restrictions, and they are all we've been very good advocates over the past few years in pushing back, so no funder at this point doesn't give us at least quite a bit of notice. They know that they're only going to see redacted files, and so that's actually limited that amount of monitoring anyway.
And that is definitely a concern. And I know, Jeanne Marie, as I have worked with different organizations that are kind of moving that direction as well, is that they've contacted they have auditors that will come in and do that kind of auditing. And they give them read-only access. So we're able to create a work group that is just a read-only work group that doesn't give them the ability to look at, so we can identify what they can see, what they can't see based on that memorandum of understanding, and then also to create just a read-only environment so they can't add records or modify any records. So yeah, it's definitely, we're moving in the right direction, I think, as we're in the information age. And one of the things I know that many funders are concerned about is the security of that information and that protection for victims. And one of the things I wanted to point out is the security for ClientTrack, not just on the servers, but in the way that the information is sent to and from the servers, right? So in transit and also in storage, we have I think it's SSAE 60, something like that, but it is the same that a bank might use, but even more robust than that. So it doesn't matter where you are when you are transmitting that information. People cannot hack into that and find out what information that you're sharing.
Okay, I think we have time for just one more question, and this is a very good question, Carol. So are those design features something you pay for just at the initial design time, or does it increase the overall cost of the system?
Yeah, that's a great question. So we have kind of two pieces that are part of ClientTrack. There is a kind of the implementation one-time kind of fees, and that you pay so you pay some up front and then you pay as those things are delivered. Then in addition to that, we have some recurring types of fees, and those are set no matter how big your one-time implementation is and all the bells and whistles that you get involved or get created for you. It doesn't change the price of that ongoing. So the ongoing is the same, no matter how complex and no matter how many clients you serve. Sometimes people will call us up and say, oh, well, we serve 15,000 people a year. How much is it going to be? And so we don't charge you more based on the number of people and the number of records that you have. It's a licensing type of thing.
Great. Well, we're going to have to wrap up for today's presentation, but I want to thank Jeanne Marie again for sharing her wealth of knowledge regarding Women Against Abuse and everything that she's done in that organization to expand the offering within her area. Thank you to Carol Anderson for representing ClientTrack and talking a little bit more about the solution. Please feel free to contact ClientTrack directly. Our sales number is 888-449-6328, or visit us on the web at ClientTrack.com. Again, that sales phone number is 888-449-6328, or visit us online at ClientTrack.com. We would be happy to talk to you a little bit more about the solution and how it can impact you and your organization. This concludes today's webinar. We again appreciate you for joining us, and this will be available as a recording following today's session.